Yemen cholera cases hit 1 million in hideous milestone for worst outbreak on record. The explosion of cholera cases in war-torn Yemen is a hideous milestone. According to the International Committee of the Red Cross, the number of suspected cases has now passed the 1 million mark, making it the worst cholera epidemic on record. A desperate shortage of clean water, food and fuel left health authorities and humanitarian organizations in Yemen powerless to stop the disease. The outbreak of cholera, which began in October 2016, has killed more than 2,200 people. The Red Cross said more than 80% of Yemen's population lacked access to clean water and medicine, largely because of a Saudi-led blockade on aid shipments into the country. The United Nations said there was also a growing outbreak of diphtheria. These are medieval diseases. The UN's humanitarian coordinator in Yemen, Jamie McGoldrick, "These are telling you that your systems are collapsing and people cannot buy the medicines. They cannot buy the goods, that makes it easier to do that." Cholera is an acute infection spread by contaminated water or food that causes water diarrhea, nausea, dehydration, fever and stomach cramps. In the worst cases it can kill within hours. Humanitarian agency Oxfam's Yemen director, Shane Stevenson, said it was appalled at the impoverished country's horrifying new record. "It is a disgrace that in the 21st century, an easy-to-treat cholera could infect over 1 million people in one country." Mr. Stevenson said, "This is the world's worst recorded outbreak, a man-made tragedy driven by more than 1,000 days of a relentless and ruthless war." Month after month, the humanitarian situation in Yemen continues to deteriorate, slowly destroying every aspect of Yemenis' lives. Oxfam said more than 16 million people, equivalent to two-thirds of Australia's population, were without clean water and millions more faced losing their supply unless the Saudi-led blockade was lifted quickly. Alongside the cholera outbreak, up to 8 million Yemenis were on the brink of famine in what the UN said was the world's worst humanitarian crisis. Hospitals in the capital Sana'a and rural areas have been overflowing with malnourished children facing starvation. Blockade prevents delivery of medicine. The war in Yemen this week passed 1,000 days. Since March 2015, Houthi rebels, backed by Iran, have been fighting a US-backed military coalition led by Saudi Arabia, which has been trying to reinstate the internationally recognized government ousted in 2014. For months, Saudi forces have imposed a blockade on Yemen's ports, preventing the delivery of food and health supplies. But Saudi Arabia said on Wednesday it would open the port for a month to allow aid agency care said even a partial lifting of the blockade had not allowed aid to get through to where it was needed. Yemen's main ports must be allowed to open and function at full capacity to prevent full-scale famine and increased risk of disease, the agency said. There is no viable substitute for Hadida port on the Red Sea. Almost 85% of the population, 22.8 million Yemenis, are typically supplied by imports from Hadida port. All alternatives to Hadida port have enormous implications in terms of cost, time and security. Aid shipments are not enough. Commercial goods must be allowed too. The agency said humanitarian food aid was reaching only a third of Yemen's population. The remaining 18 million people rely on functioning commercial markets, which have been devastated by fuel scarcity and conflict. The 3-year war has killed more than 10,000 people in Yemen and displaced about 3 million. 1 million people have caught cholera in Yemen. You should be outraged. Recently, the story of Yemen has been told in statistics. A brutal campaign of airstrikes by Saudi Arabia has killed 8 million people. 1/3 of the population are teetering on the brink of famine. 80% of the country lacks access to food, fuel, clean water and healthcare. Even so, this number stands out. The International Committee of the Red Cross reported today that 1 million Yemenis have contracted cholera in the last 18 months. More than 2,000 have died, according to the United Nations. It's the largest cholera outbreak in world history. Let that sink in for a second. 1 million people have contracted a disease that we've understood how to treat and contain since John Snow sat by a water pump in 1854. For cholera to spread this fast, everything has to go wrong. In Yemen, everything has. Cholera is a waterborne illness, spread when food or water comes in contact with waste from someone who already has the disease. It's easy to protect against you're safe, as long as you've got clean water to drink and a way to disinfect food, and it's easily treatable. All that's required is fluids. As David Sack of Johns Hopkins University put it to NPR, a patient with cholera should never die. Yemen is the poorest country in the Middle East and host of one of the least hospitable climates. Much of the country is desert, and climate change has made it even harder to grow crops and access fresh water. Experts predict Sana'a will be the first capital city to run out of water. Yemenis import more than 80% of their food, fuel and water. Even so, before fighting broke out in 2015, there was no cholera in Yemen. The country's civil war changed all that. The conflict started as slow-motion coup. Houthi rebels took over parts of the country. The government fought back. Saudi Arabia stepped in, offering assistance in the form of brutal airstrikes that have killed thousands of civilians. Today, the country has no functioning national government. Parts of the country are in the hands of the Islamic State militant group or other local actors. As Chatham House put it in a recent report, Yemen resembles less a divided country than a collection of mini-states engaged in a complex intra-regional conflict. That conflict has made it much harder to move goods into the country. Saudi Arabia has enacted a blockade of water, air and land ports. Much of what does make it into the country is smuggled over several checkpoints. And Yemenis are forced to pay the price, an especially steep obstacle considering much of the population hasn't received a salary in months. Cholera has spread in the Houthi areas because of the blockade and bombing by the Saudi coalition, which has destroyed the public water and sanitation systems. Daniel Varisco, a postdoctoral scholar at the Austrian Academy of Sciences, explained. It appears to mainly be a problem in urban areas due to the breakdown of the water systems. Yemen's outbreak began in October 2016 in Sana'a, with a handful of cases spreading out to Aden and other cities. 2 months later, cases had been reported in about 15 provinces. 6 months later, about 320,000 people had contracted the disease. The pace of infection slowed, but by April it had picked up again. By June, nearly 200,000 people had been infected, and UNICEF warned that Yemen was facing the worst cholera outbreak in the world. Nearly half of the infections struck children, who suffered a quarter of the deaths. In response, the United Nations mobilized a large-scale humanitarian effort. Some 50 organizations delivered 900 health workers to the country, along with supplies and makeshift clinics. Even so, by last month, 900,000 people had contracted cholera. Those who come down with the disease have few good options in Yemen. The nation's health system has collapsed, and most health workers haven't been paid in months. Fuel is scarce, making it nearly impossible to keep hospitals running. 8 groups have set up rehydration centers and clinics, but it's not nearly enough. With so little infrastructure, even the most dramatic international campaigns can't get off the ground. Last spring, the World Health Organization mobilized to send 1 million cholera vaccines to Yemen. The plan was to get at least 500,000 doses into the country by the summer. By June, WHO had suspended the effort, rerouting the antidote to other high-risk countries. It was a decision made by the Yemeni government, which feared it wouldn't be able to treat citizens in areas controlled by the Houthi rebels. But scientists doubted a vaccine campaign would be effective. In an outbreak setting, the impact of oral cholera vaccine is greatest when used to protect communities that are not yet affected. Tarek Jassarevia, whose spokesperson in Geneva, told Science magazine, "There are few such areas in Yemen now." By June, cholera had spread to all but one of Yemen's 22 provinces. There is some good news. The Red Cross says that the number of new cases has declined for 14 weeks. Experts say the infection has likely peaked. But there are no guarantees. 16 million people lack reliable access to clean food and water. The disease could spike again in March, when the rainy season begins. Experts warn. 2. That diseases kill more people, and more quickly, when a population is underfed. In Yemen, 1.8 million children are acutely malnourished. Nearly 500,000 babies and toddlers are starving. To stem the disease, Johan Muij of CARE told NPR, "You need clean water. If there's no fuel coming into the country to make the water pumps work, then people will have to go back to filthy water again." He said. That will make cholera increase again.